Thank you so much for the kind introduction, and thanks so much for coming and braving the snow to hear about does contact reduce conflict, experimental evidence from Nigeria. And as Ali mentioned, this is joint work with Oeindrila Dube and James Robinson, both at the University of Chicago. And this, I should say, is funded by the French Development Innovation Initiative, the J-Power Crime and Violence Initiative, the USAID Development Venture Initiative, and IPA Pearson Recovery. So lots of funders that we're very grateful for that made this huge project possible. So I want to talk about farmer-herder conflict. And I don't think I'm telling you anything new that conflict is really a fundamental obstacle to human flourishing all over the world. But conflict between farmers and herders is a quite common type of conflict. And it is particularly common across Sub-Saharan Africa. And you can think of many different contexts. You can think of Kenya, South Sudan, Central African Republic, Niger, Burkina Faso, Mali, Ghana. All of those places have a farmer-herder conflict happening over the last 10 years to varying degrees. And we can think of more countries that has happened. Today, we're going to zoom in and think of the case of Nigeria. And these conflicts between farmers and herders, so farmers being agriculturalists that grow crops, and herders being pastoralists where their main economic activity is livestock rearing. These conflicts are potentially exacerbated by climate change. There's some evidence that lower rains and temperature variation can increase conflicts between these two groups as the pie shrinks, so to speak. Oftentimes, farmer-herder conflict also interacts with other cleavages in society. So often farmers and herders might be of different ethnicity, and might be of different religion. But there's a fundamental kind of question is why does farmer-herder violence persist? In some sense, the specialization into farmers and herders is kind of as old as humans having done these kind of activities. And there's a reason why people do different specializations. Having a division of labor can facilitate beneficial market exchanges, right? It might be good that some people focus on livestock rearing, while other people focus on growing crops. And this split between farmers and herders is a canonical example of humans specializing in different economic activities, right? They can exchange milk and meat and dung from the side of the herders for crops and fodder from the side of the farmers. By the way, I just wanted to mention quickly that I'm very happy to take questions if anything is unclear during the talk. I come from the School of Economics where people shout very aggressively if they don't like something. So maybe don't do that, but if you have any questions that are unclear, feel free to jump in rather than confusion persisting throughout. So however, there's room for people to engage in positive exchange, but at the same time, these different activities can have negative externalities on each other, right? So cows can trample crops. Or farmers could put pesticides or insecticides that would be bad for the cows to eat, right? So that these activities can have negative externalities on each other, right? And if that happens often enough, mutual beneficial exchange and cooperation can break down, giving rise to conflict. And as that happens, people will interact less and less with each other, which then, again, further lowers the potential benefits and further increases the risk of conflict. Now, this is where we're trying to come in and trying to think about how could such a conflict be addressed. One hypothesis that's out there for addressing conflict between different groups is called the contact hypothesis. And this has been in the literature for quite a while, recently become more popular with Pettigrew 1998. But the core idea is that if you bring conflicting parties together and get them talking to each other, this will reduce conflict, okay? On one hand, conflict can be of different types. On one hand, contact can be of a general form where we just get together and talk about anything, but not about the real issues underlying the conflict. Or you can have contact that directly tries to address the type of conflict that you're having and the underlying issues. And most of the existing work has focused on the former. They've had focused on general types of contact. So existing work has not examined effects on contact in the context of active conflict. So most of these are post-conflict societies after a conflict has already subsided. And most has focused on kind of this general form of contact. People playing soccer in the same team, people playing cricket in the same team. People going to computer classes with people of the different group. And generally, the existing literature has found shifts in individual views of the other group and what we call on the pitch behavior. So if you're on the soccer team or on a cricket team, you might end up choosing somebody from the other group as a teammate or as a captain, or you give them prizes for their performance on the field. But there's very little behavior outside of the pitch. So when you then ask people, do you have friends from the other group? Would you go to the other neighborhood? Do you do things with people from the other group? People find less effects of that. And most of these effects are measured within weeks of the intervention, right? So people play soccer or cricket or go to computer classes, sometimes for a few weeks. And then they measure what happens during those activities. And then maybe 5 weeks, 6 weeks afterwards, people ask, do you have friends? Do you go to the other neighborhood? And so we are trying to, the reason I put this slide that way is that we're trying to address all of these shortcomings, obviously, or we're trying to build up on and push it a little bit further. We are going to examine the effect of conflict and quite an active conflict, namely between farmers and herders in the middle belt of Nigeria. I'll give you some numbers in a second, but there are estimates of between 1,000 and 2,000 people dying every year because of farmer-herder conflict. And we are going to compare two forms of contact. One form is that addresses conflict directly, talking about the underlying issues that lead to conflict. And one is more a general form of contact where the underlying issues are not discussed. We're going to use a village-level field experiment to measure the effects of these different types of contact on cooperation and conflict, and then a host of other outcomes that are going to try to tell us the mechanisms of how the relationship between farmers and herders has been transformed. We're also looking a little bit further down the line than a few weeks. Our endline survey is 9 to 12 months after the intervention, so quite a bit after things have happened. We also implemented a 12-month-long smartphone data collection between 1 to 3 years after the intervention, where on a bi-weekly basis, so fortnightly is the better word, every 2 weeks, people would tell us about conflict and dispute in their community. And so that's another source of data to figure out what was happening in those communities. Okay, that was the quick overview. Now I'm going to go into a little bit more detail all of this, just to get us going, a picture of some cows. Among economists is often, if you put a picture of the economist, then it must be an important topic. So here's the economist a few years ago writing about farmer-herder violence and just showing Fulani militia attacks. Fulanis is the ethnic group that's associated with herders. And you can see quite a lot of violence in the year 2018, just the first half of 2018, due to Fulani militia attacks, specifically in the areas that we're going to look at, which is the states of Plateau, Nasarawa, and Benue. Most of our observations, as you're going to see in a map in a second, are going to be from Nasarawa and Plateau State. So according to data from ACLA from 2017, but also data that we put together ourselves in 2022 and 2023, between 1,000 and 2,500 people in a given year would die of attacks between farmers and herders. And as I mentioned in the first slide, we don't just have to deal with these economic identities and activities, but most of the herders are Fulani, that's an ethnic group originating from the north of Nigeria, and Muslim. And most farmers are various local ethnicities through the Middle Belt, and most of them are Christian religion. Now, this is not just a problem in Nigeria, as I kind of mentioned before. Here, this is from a map. It's cut off slightly from a different source. This just shows incidences of farmer-herder clashes in West and Central Africa over time. And if we just focus on the last 5-6 years here, we can see that this is not just an issue of Nigeria, though it is a big issue in Nigeria. It's also an issue in Mali, in Burkina Faso, to some degree, in Ghana, in Benin, in Chad, and in Central African Republic and Niger. Right? So it's a really widespread problem all across the larger Sahel region, where we have these different geographical areas where herders are often parts of the year in the more arid regions, and then during the times when resources get scarce in those regions, they would go to the areas where farmers are more present and then have conflicts with the farmers over the resources on the ground. Traditionally, farmers and herders have engaged in exchange based on production complementarities, the way kind of I outlined that in the beginning, exchange dung to fertilize crops, and give the residue, the leftovers of after the harvest, could then be eaten by the cows. Now, farmers and settled herders, often in Nigeria, live in neighboring communities, or sometimes even in the same community. There also are nomadic herders that don't live in a settled place, but they are very mobile within a country, and especially within Nigeria. They're often called strangers, Fulanis. We're going to come back to them at some point to explain to you what we think is going on in our story. Now, what we have found in our setting is that conflict has really reduced economic and social interactions. So in our sample, we'll find that less than half of the communities will have a shared market where they share these things together. So most of the places, the farmers and the herders, they live in separate communities and they don't really share a market together anymore. Right. So we're going to examine the effect of contact between farmers and herders residing in the same community that can either be literally in the same village or that can be a neighboring village, but sharing similar resources. And we're going to have two types of treatments. The first is what we're going to call the interdialogues. This was run by an NGO, an international NGO called Search for Common Ground. They're based in DC, but they have offices all over the world. And they do, as their name suggests, Search for Common Ground, do similar interventions where they bring together people from different backgrounds and try to find solutions of the conflict that they have. So this is an activity that they already are doing. This is not something that we personally came up with as researchers, but we kind of talked to them and thought about, can we evaluate the work you're doing to understand what is working and what is not working. And so then we got funding to get some more workshops than they would have typically done and randomize where they did it, as I'm going to talk about in a second. So the structure is quite straightforward. First, there's kind of a scoping visit, a community entry visit, where the NGO, the Search for Common Ground staff would go to a community, talk about what they're doing, and then they organize separate, what we call intra-dialogues, where the farmers and the herders meet separately among themselves, talk about the issue, what's going on, just from their perspective. And only once both groups agree to meet the other group, then they organize the interdialogue part, where they meet jointly, discuss conflict issues, and create action plans. So they have quite specific action plans of things that they want to do in the future to alleviate conflict between them. And then the NGO would have a follow-up meeting between 6 to 12 weeks after the intervention, where they would come to the community, see how much progress there have been. They would do a focus group to kind of see whether they need to readjust a little bit what's happening. Each of these workshops would have 3 paired communities. So it would be, just for logistical reasons, they would bring in 3 communities within the same district. So 3 pairs. So farmer-herder community from one location, farmer-herder communities from another location, and farmer-herder communities from a third location. So we'd have kind of 6 villages, so to speak. Sometimes they live together. That's the general idea. Village leaders are invited, and also selected households. You will see in a second when I talk about kind of the statistics we have on that. You should think of that as mostly the village leaders attending and then some households, right? But the average household will not attend this, just because there's just not the capacity to have that many people in the room and talk to each other. Then we organized what we call a healthcare workshop. So the idea was to have contact between the 2 groups, but not talk about the underlying issue. And for that, we designed with a local doctor a healthcare workshop, which followed exactly the same structure. A community entry meeting, then farmers and herders would meet separately, and then they meet jointly. But the only difference is, at none of these things were they supposed to talk about the underlying issues. They were supposed to talk about healthcare issues. And so we did a lot of piloting to figure out what do people care about in the community, what are issues that are salient to people. And we found that people really cared about child and maternal health, issues of sanitation, and this was during the COVID pandemic, so we talked a little bit about COVID preparedness. And the idea was that these would be issues that farmers and herders kind of have a stake in together. So sanitation, for example, what you do with the water in your community, things like that. So it made sense to get them together, right? And the same with child and maternal health. We want to make sure everybody's healthy. We might have to use the same healthcare facility, et cetera, to have a reason to bring. Otherwise, it would be a little bit too artificial to just bring them together to talk about, I don't know, other issues surrounding healthcare. So everything else, the structure was exactly the same. And I have some pictures here just to kind of visualize the process again. So we first had community entry and advocacy meeting where they would talk to the local leaders and kind of just the community and say what they wanted to do. And this was from the farmer community. This is here the herder community. Then they would organize the intra-dialogues. So here's a herder intra-dialogue. And they would do activities such as perspective taking. I don't know if you've ever seen this picture that can either be a rabbit or a duck, depending on how you look at the picture, right? And so this is kind of just teaching where you can look at things from different perspectives. And so just to prepare people to hear the other side's perspective in the next meeting. Here we have the farmer inter-dialogue. Again, more from the intra-dialogue, just the herder women group meeting together and talking about issues. This is the farmer women group meeting and talking together. And then when everybody is ready, there would be another day-long meeting where everybody gets together. There's some speeches by kind of authority figures. Here we have an imam speaking. Here we have a security officer speaking. And then they would also be split into groups. So the youth group, the youth leaders from both the farmers and the herders would get together and talk about the issues affecting the youth involved. You would have the elder groups from both communities getting together and talking about the issues. And then there would be follow visit. This is somebody from Search and Common Ground, organizing a focus group discussion. Does everybody feel like there's been progress made on the action plans and the things that they said? Now, the action plans typically have things about unblocking cattle routes. So typically there are routes that the cattle have to take to get to water, to get to places to graze, and farmers would knowingly or unknowingly block those. And that would often be an agenda item. Another one would be building committees to resolve disputes as they arise. And various of issues depending on what the local needs are of the communities. The healthcare workshops, again, followed exactly the same model. And here we have the day where they separately meet farmers and herders, and then we have a joint day where everybody meets together. I'm only showing those two pictures, but trust me, the setup was exactly the same. We do have a little bit of data on these workshops. We had both the local doctor that organized the healthcare workshops and the NGO provide us collect some data at these workshops. For the inter-dialogues, their average attendance was 56. So that means about 19 per farmer herder pair, right? Because there were always 3 communities that together. So again, you should think of that, right? That's about 10 farmers, 10 herders. You should think of that really just being the leaders and maybe a couple selected households that are attending. A third of the participants were women. 10% of the workshops, according to the organizers, had tense moments or verbal arguments. So there was some tension, but not in the majority of workshops. The health workshops were very similar. We had an average attendance of 60, again, a third of them being women, but had actually a little bit more tense moments at 70%. And that might already be a little bit of a foreshadowing of what we're going to find in a second. Right. So how did we exactly design the study? We had a baseline survey of 288 communities in the middle belt of Nigeria, in Plateau, Nasarawa, and Benue State. Only 9 of those communities were in Benue State because Benue State has an anti-grazing law where basically herders were not allowed in Benue State during the time of our study. So we found very little communities willing to participate because of that issue. And so then after that baseline survey, we in each LGA, local government area, that would be kind of a district in Nigeria, we would then select groups of 3 to be assigned to the inter-dialogue treatment, the healthcare workshop treatment, and the control group. In the control group, nothing would happen, right? And so you can see them here in the different colors. Each district will have them in groups of 3. So they'll always in each district, in LGA, there'll be 9, 18, 27, 36 communities so that they'll can be put into groups of 3. Okay. In each community, we surveyed 11 households, 5 farmers, 5 herders, and 1 household who both farms and herds or has done both of these things in the past, because we wanted to get at how information about the other activity might affect your choices. And then we surveyed the farmer village chief and the herder village ado as kind of a community leader who has good information about what's happening in general in the community, and 4 other key informants. But the results on the leaders that I'm going to show you are going to focus on the farmer village head and the herder ado. In total, we surveyed almost 6,000 individuals in our end line and even more in our baseline. And just to give you a little sense of what a community looks like. So these are some pictures. These are from herder communities. These are from farming communities. And I also have some stats about those communities. So we have the typical community has about 644 households. Out of them, 68% will be farmers, and about 19% will be herders. So typically, you should think of the farmers being in the majority in those mixed communities. We have majority of people following Islam, 56. You should think of the herders being exclusively Muslim. I don't think we found anybody, any herder that's not Muslim and not Fulani. There's a lot of more heterogeneity among the farmers, both in terms of ethnicity and in terms of the religion. So we do have also a health and blood index for ethnicity among the farmers, just to see kind of the variation. A typical community will have 19 disputes in a given year, but there's a lot of variation. Some have over 100, some have a little bit little. And here's what I talked about, that only 44% of communities will have a common market that they share. On the household level, we have an average household size would be about 8 to 9 people. 99% of the household heads are men in this setting, but it's quite a poor setting. We have only 44% of household heads have at least a primary education. When we did our smartphone data collection, we needed to have herders and farmers that could read or write, and we had a very hard time finding enough herders that can read or write. And so in general, I haven't shown this to you, split up between farmers and herders, but in general, you should think of the herders being a lot poorer than the farmers, at least on the observable characteristics that we can see. About 66% of kids are in school, 30% of houses have thatched or grass walls, just to give you a little bit of an idea of the socioeconomic background of our sample. The average household is involved in one dispute per year between farmers and herders, but again, a lot of variation. About 50% of people is actually involved in the dispute, so we have 50% with about 0 disputes, and then 50% with 2 on average, right? If we're putting that together. And 10% of households are involved in violence. So they either have a dispute that turned violent, or they were the victim of violence, or they participated in communal violence. So that's right. That's not a low number. 10% of the sample. Okay, so I'm gonna kind of go kind of fast over this, but we have kind of a statistical model that underlies the analysis that I'm going to show you in a second. But basically, since this is a randomized experiment, it's fairly straightforward. We're just going to look at individual responses of a household or a leader in a given village. And we're just going to look at whether the village where that household or leader is, did they receive the interdialogue treatment? And then that coefficient will tell us the effect of the interdialogue treatment on the outcome variable, and whether they were in the healthcare treatment arm, and then that coefficient will tell us the result for that. Happy to go into more detail of that, but I think the story is a little bit more interesting than intricacies of the analysis. So the way that I'm going to go through this is I'm first just going to show you what are the different outcomes that we looked at. I'm going to show you some graphs to visualize them, but then mostly I'm going to talk about the story that what we think is happening. Okay. So the main outcomes that we cared about was cooperation between farmers and herders, and we separated that into different types of actions that either the farmers can take or the herders can take, because cooperation kind of depends on both sides doing something. Then we looked at institution building and social networks as one of the main things that the dialogues were attempting to do, that is building institutions to solve disputes and to build networks specifically between leaders in the community. Then we're going to look at the incidence of disputes and violence. And then we have a host of variables trying to understand what exactly happened. So one was migration, stereotypes and empathy about the other group, economic outcomes, and behavioral outcomes. And then I'm going to very briefly talk about the smartphone data collection as well. Okay, so the way I'm going to show you the results is we'll have here different outcome variables. So here's, for example, the social networks index, whether you know people from the other community, whether you see them often, whether you have their phone number. Or here, we have an index of dispute resolution, whether there are committees to solve farmer-herder disputes, how old are they, do people say that they're happy with the way disputes are resolved in their community, etc. Okay? Now I'm going to show you a coefficient, and what we really care about is this coefficient different from 0. So in the case of here, when we ask households whether they know people from the other side, people that did the interdialogue, they are not differently from 0, that meaning they don't know more people than the people in the control communities. That's not very surprising because the households didn't actually attend the workshops or that many. So it's unlikely that they suddenly know people from the other community more than in the control community. However, when we look at the village leaders are much more likely to tell us, yeah, they know the leaders from the other side, they have their phone numbers, they've talked to them in the last year, right? So first, good sign, the dialogue did something in terms of building social networks. When we ask households about dispute resolution, they're not, when we ask households about and village leaders about dispute resolution, both of them say that dispute resolution has gotten better in their community. So they're happier with how disputes are resolved. There are more committees that solve disputes in their community. Okay, so positive news here first. So social ties and institutions improve. Now, when we look at cooperation, the picture becomes a little bit more muddy. Overall, households tell us that cooperation has become better. Village leaders are not so sure. But when we break this down into actions that the farmers take versus actions that the herders take, we can see that both tell us that the farmers have done things to make the situation better, such as unblocking cattle routes, waiting longer to burn the bush, putting up signs when they use pesticides, giving permission for people to graze. But the herders actually cooperate less, meaning they more often graze without permission. They're more likely to trample the crops of other people. So kind of strange that we have more cooperation with the farmers, less cooperation with the herders. When we look at disputes and violence, we again see a negative impact here. So meaning we have more disputes, according to both the households and the village leaders, happening in places where we had our interdialogues. This is all compared to the control communities. Okay, so more disputes. So we have better social networks. Let me put the summary slides. We have better social ties and institutions, overall more cooperation, but really only by one side, and we have more disputes. Violence remained unaffected. Why might this be happening? This is one reason why what might have happened. We asked village leaders whether there were more herders from the outside coming into the community in the last year. And places where we had our interdialogues had more people coming in from the outside, about 20 percentage points more. So the story here is that the herders across the region communicate with each other, right? They have WhatsApp chats, sometimes they're related to each other, and they tell each other where are good places to graze their cattle in a given season. And herders hear that in the interdialogue communities, the situation between farmers and herders has improved. So this now becomes a more, a nicer place to go. But having new herders come in creates several problems, right? At least three here. One problem is we just have more people competing over the same number of resources. The second is the new herders don't know the rules that got established in the interdialogues. And the third one is that the existing herders have now some kind of fog of war where they could say, well, I did my thing, but the other herders, the new herders, reneged, when really it could have been them as well, right? Sometimes you don't know whose cattle is who. We did a mediation analysis that suggests that this influx explains between a third to almost 2/3 actually of the effect of disputes and cooperation. So it could be that it's really these new herders that are driving the negative impacts of these interdialogues. I'm not going to show you kind of the other results that we have here. Happy to know if anybody's interested. We don't find any impacts on stereotypes and empathy. So people are not more likely to have positive stereotypes or negative stereotypes or empathy towards the other group. No effect on behavioral measures. We played a dictator game and a public goods game to measure how much people trust the other group and how much people share with the other group. No effects on that front, and no effect on economic outcomes. So now very briefly, I want to talk about the healthcare workshops. So this is this context where people talk about the issues, right? Now we're looking at the healthcare workshops, which, remember, those are the ones where there is actually a little bit more tension in these workshops. Maybe could be for several reasons. Could be because they didn't talk about the issue. Could also be because our implementing partner was slightly less experienced in organizing these workshops than Search for Common Ground was. But first, we don't find any effect on social ties and institutions. People are not more likely to say that they have good dispute resolutions. They're not more likely to say that they know the other party, even the village leaders. Cooperation overall seems to worsen, not very big effects, but there seems to be negative cooperation. And then I want to have a quick look at the disputes variable. And according to households, again, disputes go up here, double the size of what we have in our interdialogue. So blue now here is the healthcare workshop. Village leaders don't seem to see an increase in disputes. No effect on violence again. So more disputes in the healthcare workshops. we don't find any influx in herders in those communities. And that makes sense because the situation is not actually getting better. Why would new people come to those communities? So that can't really explain what's going on. But the other thing I want to show you is our questions on discrimination and empathy. So when we ask village leaders about their stereotypes of the other group, people that went to the healthcare workshops have actually more stereotypes about the other group. And they have lower empathy for the other group. The way that we interpret that is that if you imagine you're having a fight with someone over some issue, and then I put you together to hang out for an hour, but I tell you you're not, we didn't actually tell you that, but told them not to talk about the underlying issue, right? And then anything that person does, it doesn't matter what it is, annoys you, right? Just because you have this underlying conflict with them. And so the stereotypes kind of got reinforced by this contact that didn't address the underlying issue, which then led to lower cooperation and more disputes. And worse, atmosphere at these interventions. We again find no effect on behavioral measures, no effect on economic outcomes. Okay, so the overall story for the interdialogues, I think it's kind of a mixed success. Institutions get better, social networks get better, cooperation by the farmers get better, but there seems to be herders taking advantage of this thinking. And part of that is driven by herders coming in from the outside. So it's like this externality of making things better at the local level if you have one of the groups that's kind of very, very mobile. On the healthcare side, this just overall seems to be a bad idea, right? Bringing people together. Though I think this is the most common form of contact is this form of contact, the most commonly studied form of contact. It's having people play football together, having people play cricket together, having people do computer classes together. This is quite common form of contact and quite well studied, but not with the kind of long-term conflict cooperation outcomes that we have here, right? So the last thing I want to look at is smartphone data collection. So we distributed 2 smartphones in each paired community, so one to a farmer and one to a herder, and we tracked the respondents to fill out fortnightly surveys on disputes and violence in the community. We had about half of our sample that couldn't read or write or manage a smartphone. So we would give them what's in Nigeria called a no-touch phone, and we would call them every 2 weeks and do a phone survey with them. The data collection lasted for 12 months, from September 2022 to September 2023. Depending on when the intervention was, because the intervention was kind of in a staggered basis, that was between 2 to 27 months after the start of the intervention. So most of this was more than a year afterwards. You should think of that happening after the endline data that I showed you so far. We have the IPA Nigeria team did a remarkable job of having over 95% response rate. We have 571 respondents, over 15,000 surveys. Overall, we have about 4,000 disputes being reported in that data, and 550 number of violent events. But actually, fairly little farmer-herder violence, only 159. Another thing that I think we learned that I want to quickly point out is that most of the violence that we're seeing in our data does not seem to stem from disputes between farmers and herders. So there might be violence between farmers and herders, but from our reading, most of it is driven by militias, by politicians doing things, and it's not really local community level versus local community level. And that also explains why we haven't really found any effects of either intervention on violence, because these are things that are driven not at the local level as far as we can tell. For the smartphone data shows no effect on disputes, not really an effect of violence. And for the healthcare workshop, an increase that is imprecisely measured. So maybe disputes go up also in the longer term for the healthcare workshops, less so for the interdialogues. So we looked at a bunch of other stories of what could happen here. So one reason might be that they're just interacting more with each other. And if you're interacting more because the situation is better, then there's more room for disputes. We don't actually see any evidence of that. So there's less grazing on other people's land. There's no effect on economic exchange. So there's not a lot of evidence of more economic interactions, at least. We don't see that the results are driven by herders being a lot poorer and because of that trying to take more advantage of the farmers. And it's also not driven by communities where farmers seem to be more or less aggressive. when we ask farmers and herders, they tell us about the same thing. So it's not just one side is kind of lying to us or trying to present themselves in a better light. We had the fear of that happening in the baseline, but in the end line, we feel fairly confident that that's not happening. We also looked at distance to migratory herder routes, the religious or ethnic composition. I'm happy to talk about any of those in the Q&A, but I'm just going to speed through them right now. And we do find that our effects are driven among the people that just do one activity. So it seems like getting people together has very little effect on the people that farm and herd. They basically already knew what the problems were for the other side. And so they adjusted their behavior less than the people that just did one activity. They seem to have learned something new about the other side in these interdialogues. So let me quickly wrap up. The overall question is, can contact increase cooperation in active conflict? And I think the answer is like a mix, right? It's like, yes, cooperation can increase, is increased and institutions develop, but only one side cooperated. There's this influx of herders because the situation got better, and this increase in disputes, though we think no effect in the long run. Simply getting people to talk to one another through contact is not sufficient for improving cooperation and reducing conflict. The healthcare workshop, did not do the trick, right? And so when contact does not address conflict, it backfires, it reduced cooperation and increased disputes without reducing conflict. And when contact addresses conflict, groups, they attempt to reconfigure their relationship, but with mixed success, right? So we think that the latter builds in the right direction, right? So this contact while talking about the underlying issues, but further work is needed to kind of understand how can contact serve to reduce conflict and not increase disputes, and what would happen in the long run if you start cooperating, but you see the other side reneging and you see the other side increasing disputes. Maybe eventually that will have negative impacts unless you bring kind of the new people back on the table and you do things to address that issue. Thank you very much. I'm looking forward to hearing your feedback.
Questions?